Hi everyone. My name is Lamia Jouini. I work as a psychiatrist in the Wallis Hospital in Switzerland, but I also work as a part-time consultant at the Brain Health Unit at the World Health Organization. And today I will be presenting on behalf of the Brain Health Unit and on behalf of the team that you can see the names on the screen. So thank you very much, Takoua, for the thorough presentation about the impact of perinatal mental health and the child outcomes and development. I know that usually we see perinatal mental health problems at the specialized level, the third level, the hospital, the psychiatric unit. But today I will be talking about the importance of integrating mental health services in maternal and child health services at the primary health level. So I wouldn't go into details since Takoua already talked about it, but just saying that the perinatal period, as defined by the World Health Organization, includes the duration of pregnancy and the year after birth. And as she said also before, we know that pregnancy, childbirth, and early parenthood can be very stressful for the woman, as it impacts her identity, her physical health, the economic situation of the whole family. So we know, for example, that anxiety and depression are common during this period, and it affects an estimated 1 in 10 women in high-income countries and 1 in 5 in low and middle-income countries. So as I said before, the prevalence is high. Worldwide, about 10% of pregnant women and 13% of women who have just given birth experience a mental disorder. In developing countries, the prevalences are even higher. It can even go to 15.6% during pregnancy and 19.8% after the childbirth. And the burden of the mental health condition in the perinatal period is unequivocal. It affects 1 in 5 women. And among this affected women, up to 20% might experience suicidal thoughts or acts of self-harm. So we developed the impact on the child, maybe just to say that it's really important to recognize that maternal mental disorders can have consequences that go beyond the woman and the child. It will impact the whole family. And there is a whole body of evidence that shows that the maternal mental health disorders would be associated with a range of psychological and developmental disturbances in the child, and this will have even generational impact later on. So why it's today important to talk about the integration of perinatal mental health into maternal and child health services? Here are 6 good reasons for integration. So first, the burden of perinatal mental health disorder is great. As I mentioned before, the perinatal mental health conditions are prevalent. They create a substantial burden for the affected woman, for the babies, for the family, and they produce an impact on the economic situation and the social hardship that can affect society as a whole. So it's not only the family and the woman, but the whole society that can be affected if these issues are not treated. Then the mental and physical health problems are interwoven. So we know that many women suffer from both physical and mental health problems, and the integrated care for women in the perinatal period will ensure that they are treated holistically. So this will meet their mental and physical needs as well. Third point is that the integration in maternal and child health services would enhance access for this woman. So the woman would for sure go to seek help for the maternal health issues, for example, or for her babies, or to have the consultation, and this will allow to do the screening at that level if there is any other mental health issue that need to be treated. Integration will allow for better treatment coordination between the different parts. So this should be a multidisciplinary approach, And when perinatal mental health is integrated, the woman can access perinatal mental health services. At the same time, they access the maternal and child health services, and this will maintain their daily activities and will give them access to a full panel of services. This will also facilitate the community outreach and mental health promotion, And also this will enable for the monitoring and the management of the affected individual on the long term. The most important point, I think, is that the primary care for mental health promotes respect for human rights, and it will also reduce discrimination of this woman. So if this woman, for example, some women would avoid to go to the psychiatric hospital to seek help for their psychiatric problems, but it would be easier for them to go to a primary health care where there is mainly maternal and child health services provided. And finally, integration generates good health outcomes. The majority of the women with perinatal mental health conditions treated at the primary health level would have good outcomes, especially when linked to a network of services within the community. So, to help with the integration, to facilitate integration for the people interested, the WHO started by creating the Guide for Integration of Perinatal Mental Health in Maternal and Child Health Services. And I hope that now that I convinced you of the importance of integrating, that you will come with me and let's delve together into the process of the integration and how to do it successfully using this guide. So the guide would offer step-by-step guidance to plan for the integration and the assessment of maternal child health issues in maternal and child health facilities. It is mainly aimed at the program managers, the health service administrators, and the policymakers that are interested and are planning to do the integration. And it provides a step-by-step guidance on the integration with practical tools that we will see later on. It covers different dimensions, including policies, planning, training, supervision, monitoring, etc. And it gives also the best available evidence to support the providers in the promotion of mental health, the identification and the screening of symptoms, and the management of the disorders. So we have 6 sections in this guide, and I will guide you briefly through each section. And by the way, you can access it on the WHO website. We have a PDF version that you can download. So the first section introduces how is perinatal mental health understood, and it gives examples of poor mental health during the perinatal period, which of course might be expressed in different ways, such as feeling sad, having difficulty in concentrating, feelings of guilt toward the baby, feeling that something bad is going to happen to the mother or to her baby. The next section will provide an overview of evidence-based interventions that can be part of a comprehensive package of care. And here we are using a step-by-step approach, step care approach. So the more severe and long-lasting the condition is, the more intensive the intervention will need to be. For example, if the woman would have moderate to serious mental health conditions, the treatment would be a referral to a specialized care. But if the woman is experiencing more mild symptoms, the treatment would be a brief evidence-based psychological intervention. And I will also talk about examples of these interventions, and then we would do the referral if no improvement. But here it's important to note that even women with good mental health may still face day-to-day challenges, and also could benefit from maternal mental health services at the maternal and child health level. And this would include, this is kind of the basis of the pyramid, which means that the woman. Sorry, I did something on the screen, right? Yeah, sorry. Anyway, so this means that the woman has the right also to have respectful and non-stigmatizing care. She has the right to have a promotion on the intervention that are available, and she will also have. She also deserves to have access to maybe some screening to identify if there is any risks for developing mental health conditions. The next section describes the steps for effective integration. So effective integration requires forming a core working team that would be responsible for overseeing the integration and engaging those that are important for the funding and for the delivery and the uptake of such interventions. Then what we do is a situation analysis. Of course, we would need to know what is already available in the country and what is needed. So situation analysis and needs assessment will be useful for developing a feasible package of interventions that would be based on the needs of the woman attending the maternal and child health services. And once we agree on the targets and we develop the plan and the budget, we need to prepare for this intervention, which means that we need to ensure that the strategies for delivery are suitable for the setting, which means that they should be adapted to the local beliefs of the woman, their values, their attitudes, what they believe in, the religion also of this woman attending the maternal child health services, but also the providers that are delivering the interventions. And what is also important is that that the care pathways are clearly defined. So, for example, we could screen for women and we diagnose depression, but then what will we do with this woman? To who we should address this woman? What is the other services that are available? For example, the social services, the welfare services. So we need to map the care pathways that are available in the country before starting to implement this kind of interventions. We also need to ensure that the maternal and child health services are well trained, that they have the support they need, and that they also are supervised. So once we have our core working team, we have our stakeholders and we have established the needs, collected the information, carefully prepared for the integration. Now we should to ensure that the provision of care promotes good mental health that is adapted again to the local cultures and that enables treatment of this woman, but also not to be inclusive of all women, whatever are the condition or their specificities, without any discrimination or stigmatization. The fifth section is more for the provision of care for specific needs. So we know that some women are more vulnerable to mental health conditions during this period, this fragile period. And women who have additional needs during pregnancy are likely to experience greater stigmatization and may struggle to engage with services for different reasons. Section 5 aims to increase service providers' awareness about this population's needs, how we can support them in a better way, and where to refer them for their additional care. It is really important, and I'm emphasizing about the importance that those services are respectful, inclusive for all women, and each category provides a brief description of the characteristic, the associated additional needs and resources that could be used in the different situations. And we go to the final section, which is about monitoring and evaluation. So in this section, we highlight the need for regularly collecting information on the provision of perinatal mental health care in order to have an insight into the areas of success. So we need to know what worked well, what needs to be improved, and this will go through ongoing quality control. So the monitoring and evaluation should include channels for women and service providers to offer feedback. The report should be confidential. It should allow for reporting of complaints, for rights violations, or positive care experiences also. Forget also sometimes to report the good things that are happening. The MNE plans for perinatal mental health care should be developed and integrated into the local maternal and child health services. This is really important for the uptake of the monitoring and evaluation system. And it's important to have information using different methods, for example, qualitative methods like surveys, written responses, but also qualitative focus groups, interviews, by the women that are accessing those services. So I'm done with this guide, but it's interesting to know that this integration guide has been developed following a series of previous recommendations from the World Health Organization that supports the integration of perinatal mental health into maternal and child health services. In 2014, WHO issued the WHO recommendation on maternal and newborn care for a positive postnatal experience, which highlighted the importance of screening, diagnosis, and management of postpartum anxiety and depression. In 2020, the WHO released guidelines on improving early childhood development, and they provided also direction for the strengthening of policies and programs to better address early childhood development, but it also recommended the importance of integrating psychosocial interventions to support maternal mental health into childhood and development services. Maybe you've heard also about the nurturing care for early childhood development, the framework that they also developed in, not only for the child, but also for the mothers and other caregivers. And finally, the World Health Organization is currently working on updating the recommendation for antenatal care to ensure a positive pregnancy experience. And we are working with them in order to integrate guidelines about the perinatal mental health and its impact in the antenatal period. Furthermore to these recommendations, WHO has developed with partners and stakeholders different programs and tools. For example, we have the MHGAP intervention guide that is also being updated. And the Thinking Healthy program. So the MHGAP, I think it's quite famous. It was developed for the use by the non-specialized healthcare settings. And the aim is to provide them with evidence-based interventions to identify and manage several priority mental health conditions. And one of them is depression in the perinatal period. The Thinking Healthy is one of the brief psychological intervention that I've been talking about that we can provide at the primary health care level. And it's specifically aimed at the perinatal depression, the postpartum depressions. So it consists of 16 sessions that are delivered over a year. It uses techniques from the CBT, the cognitive behavioral therapy, and the program is designed to be integrated into the existing work of the community health workers. So it should be integrated at the primary health level within the work that is already done. And this is to avoid the extra burden of the healthcare worker and facilitate their day-to-day activities. And this is a 5-day training that is based on the experiential learning and is also required for implementation. So I've been talking now about what is existing, the tools that are already developed. Now I'm going to talk about the work that is under progress. So this is all what I'm going to be talking about now is still a draft that we are working on. It's still not validated officially. Now we are working on what we are calling the implementation package. So the implementation package aims to facilitate the perinatal mental health integration. It aims to provide practical advice on how to integrate perinatal mental health, and it's aligned with the steps for effective implementation mentioned earlier, so the steps that are mentioned within the guide. So what we did is that we took each step, we broke it down into different actions, and for each action, the implementation package provides an overview of the action, key messages, and different materials that can be used for implementations. Some examples of included resources are job aids for screening and managing different mental health conditions, templates for mapping stakeholders, referral, follow-up. There are many other tools that can be used. And what I think is interesting to know is that maybe what I included here that I think is interesting to talk about is the job aid for screening. So this job aid provides the pathway that the healthcare providers at the maternal and child health services can use in order to diagnose the different conditions. The importance was that it will be simple, clear, woman-centered question, short and concise. Again, not to overburden the healthcare workers that already are having other activities. And we developed it for the main conditions of the MHGAP, so depression and anxiety, psychosis, bipolar disorder, suicide and self-harm, and substance use. And I will show you now an example of the job aid for depression. Again, this is all still under work. So as you can see here, we talk since the woman is presented at the MCH services and all the algorithm that goes into the diagnosis of the depression with questions that are centered on the woman. And it's a kind of yes, no, what the MCH worker should know, if it's a yes or if it's a no. We hope that this would be at some point practical. Of course, we are also aiming at validating this job aid in one of the sites that we are working on. Then we have also screening tools that are within the implementation package. There are some short, some ultra short of these tools. Of course, countries should adapt and validate these tools to their local language and provide training for healthcare workers on how to use them. And it's important to note that the screening process is only helpful, again, if there is an available treatment program with the established referral services. It's nonsense to screen a woman if we cannot then refer them to the adaptive care or to provide the treatment. Finally, screening should be regularly and repeatedly conducted during the antenatal and the postnatal screenings. We are also working on developing core indicator for the monitoring, and there is an article coming soon that will be published, hopefully within the next month. All right, so those are some examples of the work that are being undertaken. We are collaborating with the African regional offices. I'm sorry if you hear some baby screaming in the background. I said that we are collaborating with some African and regional offices and country offices to help countries in the integration process. For example, in the United Republic of Tanzania, the collaboration activities have focused on the following area: sensitization and awareness raising. We did a webinar, a sensitization webinar on the 13th of February, and we brought stakeholders together to discuss approaches to maternal mental health integration. Technical support to countries. We also made a workshop on the 10th and 11th of May to identify key criteria, the strengths, the gaps in providing the maternal mental health care. And also, we are working with them on developing the tools and the practical guidance. And again, there was an implementation workshop on the 11th and 30th of June to identify and harmonize tools for the integration. You can see also here some examples in Kenya, in Mozambique. Now we are also planning to hold an African workshop next year, gathering different, around 5 African countries to orientate cross-cutting teams on the relationship. And there are plans also to have an EMRO in the Eastern Mediterranean region workshop. I think it's important not to only talk about the WHO work, but to mention also the PRIME initiatives. So you might have heard about it. It's the Program for the Improving of Mental Health Care. It's a research consortium, which aims to generate evidence on the implementation and scaling up of treatment programs for priority mental health disorders in low and middle income countries, including maternal mental health. And the first step in PRIME was to do a cross-country situation analysis first about the services available. And we have 2 case studies here in India and in South Africa. Maybe I won't go into details since I might be late in my presentation already. But as you can see, they did the training, the screening, the implementation phase. They enrolled 231 cases here, and now they are doing the scaling up in 9 facilities. So as a conclusion, scalable low-intensity psychological interventions such as Thinking Healthy have been successful in reducing symptoms of maternal depression. It's a non-specialist delivered intervention that have proven to be effective, cost-effective, and it benefits both the mother and the child. The integration of such intervention into the primary healthcare level, the maternal and child health level, through a step care approach shows promise for a comprehensive care. However, we need for this to develop guidelines, tools, implementation packages in order to facilitate the integration for the interested managers and stakeholders. I will finish my presentation by thanking you and thanking also the KBFUS Fund that has been supporting the WHO with this process. And thank you for listening to my presentation.